Ladies and gentlemen, I will not take your time because we have a very short time frame, but just go straight into the program and invite my co-convener, Dr. Madzima, to lay the foundation, and then we go into the panel discussion. Once more, welcome to the panel members, and thanks for being with us. Good morning.
Thank you, Taj. Good afternoon, everyone. Let me recognize the ministers, the Honorable Ministers of Health and Childcare, and the Honorable Minister of Finance. I want to welcome everyone here to ICASA. Thank you so much for supporting ICASA, and thank you for coming to this session on HIV sustainability in Zimbabwe. We have 3 objectives, ladies and gentlemen, which our panel will try and elucidate and talk about. This is a very high-level meeting, as you note. We have the Minister, the Honorable Minister of Finance. So we want engagement on not only HIV sustainability, but health in general. So this dialogue has already started, and there are consultations along the way. But we think that this is also very important. The second objective, we are going to reflect on the existing models of HIV financing in Zimbabwe and see how they can be exploited and include innovation. Not only again for HIV, but for health in general. And we are going to propose recommendations at policy level on how we can sustain HIV. So at this stage, let me invite the President of the Economic Society for Zimbabwe, Dr. Chanakira, to moderate the panel of experts who are here. I thank you, Dr. Chanakira. Thank you.
Good afternoon, ladies and gentlemen. Let me ride on the protocols already observed. We have about 45 minutes in which to actually conduct the business of the day. I'm going to ask our Honorable Minister of Health and Childcare, Dr. Mombeshora, who will get probably 10 minutes to make the headline comments. And then, of course, we've got 4 other panelists, and we will then have a discussion. So over to you, Honorable Minister. I think you've hit the ground running, I was saying earlier on, since your appointment. But over to you. Thank you.
Thank you, Nigel. Let me recognize my colleague, Professor Mthuli Ncube, on my right here, who is the Minister of Finance and Economic Development. The journey towards sustainable and localized HIV program is a long-term process, and I'm glad to report that the sustainability assessments to understand gaps are currently underway. Thanks to PEPFAR and USAID for the financial support towards this important work. The desire is to have a roadmap ready before the end of the year 2024 with a clear transition plan towards increasing domestic financing on HIV and health as a whole. Currently, my ministry is deploying a combination of strategies which include service integration where appropriate. The areas include integrating HIV and non-communicable diseases, HIV and TB, HIV and sexual reproductive health, and also multiplexing of laboratory equipment, gene experts, that is TB diagnosis and early infant diagnosis. Also task shifting without compromising service delivery and service quality. We also are looking at differentiated service delivery models, public-private partnerships, and human resources management. The updating of pre-service training curricula for health professionals with HIV/AIDS information and use of integrated and blended learning approaches for in-service training. Private sector are key in this journey, as well as communities, as evidence has shown that community-grown and led interventions are more sustainable. My ministry is therefore finalizing a community health strategy which shall support sustainability work in the coming years. Zimbabwe is among the highest HIV-burdened countries with a prevalence of 12% and 1.3 million people living with HIV, of which 72,088, that is 5.5%, are children. HIV estimates of 2021 give us these figures. The mother-to-child transmission rate is at 8.1% against a target of more than 5%. To date, 92.9% of pregnant women are receiving antiretroviral therapy, that is ART, thereby giving birth to HIV-free children. Despite significant progress being made in achieving the global UNAIDS 95-95-95 targets and on testing, treatment and viral load suppression among 15 to 45-year-olds, disparities and inequities persist with regards to children under the age of 15 years, with a low coverage of 6,586, which means they are still below the 95-95-95. Translating to a 65% of children tested for HIV, 100% of those tested on treatment, and 86% of those on treatment being virally suppressed. Gender inequality is one of the drivers of the new HIV infections. New infections are high amongst adolescent girls and young women, and the country has a high adolescent pregnancy rate of 22%. At least 1 in 3 women and girls have experienced various forms of gender-based violence, which limits their decisions on issues such as their sexual and reproductive health. The health sector HIV/AIDS plan demonstrates the government of Zimbabwe's commitment with support from local and international stakeholders to scale up HIV interventions towards epidemic control and eventually ending AIDS as a public health threat by 2030. As financial resources towards HIV and AIDS have continued to decline globally, Zimbabwe is equally affected with funding from multilateral organizations, for example, having declined by 9% since 2011. The country has continued to be supported mainly by external resources, with donor funding for the HIV/AIDS response accounting to 80%. The largest financiers for Zimbabwe are PEPFAR and the Global Fund to fight HIV and AIDS, TB and malaria. With the ongoing global challenges, funding for HIV, AIDS and TB may not be sustained at the current level in the foreseeable future, creating a potential gap in sustaining the provision of HIV treatment and prevention efforts to reduce new infections, especially amongst children and young people, in particular adolescent girls and young women. Increasing levels of domestic resources and improving efficiencies in resource utilization is critical to mitigate such funding risks. The Ministry of Health and Child Care, working closely with health development partners, CBOs and CSOs in general, mounted one of the most successful HIV responses in Africa. Once one of the hardest hit countries by HIV, Zimbabwe has shown the world that determination, smart partnerships at global level and community level using evidence-based interventions are key in combating HIV. This dialogue is therefore intended to engage policymakers and decision makers on HIV sustainability, reflect on existing HIV financing models, and explore opportunities for innovative financing options for health exchange knowledge, and generate policy recommendations that contribute towards a sustainable HIV response in Zimbabwe. I thank you.
Fantastic that the Minister was brief, succinct, and to the point. And our next speaker is the Minister of Finance and Investment Promotion. I think hot off the heels of the national budget. I'm sure he has a lot to say with regards to the financing and the innovative side of it. But over to you, Professor Mthuli Ncube. Thank you for being here.
Thank you. Can you hear me? Thank you. Colleagues, good morning. Suddenly, you said hot off the heels, Nigel. I'm just coming from Celebration Center, where we're discussing the budget and our budget proposals. Very exciting indeed. And I enjoyed the discussions thoroughly. Colleagues, when we invest in health, or when you spend money on health, it's not just expenditure, it's investment. You are investing in human capital. In my previous life, I did some very detailed work, research work on Uganda, not Zimbabwe, Uganda, where we analyzed the economic impact of shifting tax, first of all, expenditure towards health in that country. Maybe there's some Ugandans, you'll be able to listen to this. What we found out that an increase in allocation of tax revenues to increasing the budget on HIV had the impact of increasing GDP growth in Uganda by as much as 2%. Medication. Actually, they work, they consume, they pay taxes, and if they start a business, they live an almost normal life. They're very productive human beings. So investing in HIV specifically is an investment in the economy in the first place. So in Uganda, we found that it improved growth by as much as 2%. That's very important. So in Zimbabwe, we are very committed to maintaining whatever measures we're implementing in that area. Starting, of course, with health. In the health sector, if you look at the budget pre-2020, we're allocating something like 7% of total revenues towards the health sector, the Ministry of Health. Then, after 2020, we shifted gear and now are allocating above 10%. And in fact, for 2024 budget, we've allocated 6.311. It's not working. You can see it. 6.311 trillion Zimbabwe dollars out of a budget of 44.012 trillion Zimbabwe dollars. That's a percentage. In terms of percentage, that's 14.3% of the budget being allocated to the health ministry. That's that is the right. In health is an investment in the economy and productivity in the first place. Coming to HIV specifically, we currently have in place a 3% HIV levy, which we have ring-fenced and we will maintain. We are committed to that. It will not be removed, not anytime soon, not by anybody. It continues. I also thank the international partners. I know Madam French is going to speak in a minute, PEPFAR, the Global Fund, for the support they give Zimbabwe in the HIV response agenda, but also they can see what we'll put on the table ourselves, that we're skinning the game, so they feel comfortable to keep supporting us. So that AIDS levy continues. We want to do more. One thing I realized, I'm an economist, a mathematical financial economist to be precise, so I had to learn quite a bit when it comes to HIV issues. I realized that the HIV has got comorbidities which turn out to be non-communicable diseases. It's cancer, cardiovascular issues, and so forth and so forth. Some of you are experts, you know what I'm talking about. So we thought it necessary, again, to come up with some other ways to fund these, the response to these comorbidities. So last year we introduced some sin taxes on cigarettes and on alcohol. This year I've introduced again an additional tax on sugar drinks. Currently the figure is 2 cents per gram of sugar in a can of Coca-Cola. Of course there's an outcry from manufacturers, oh, it's too expensive and all of that, but the principle is clear. We want to create a cancer fund. That's where we're going with this, and that's a very noble thing to do, where we link taxes on sugar to the creation of such a fund. So we will continue innovating in this area to make sure that we can support HIV response agenda, as well as other innovative ways to finance the whole NCD and non-communicable diseases space. Going forward, we have other ideas. In fact, a few years ago, I did propose us launching what we call a health bond. What you do here is as follows. Once you have an income stream that you can ring fence, let's just take the 2% levy on sugar, for example. You know it's coming in every month, in fact every quarter, as companies pay this tax and so forth. There's an income stream, is very clear. You can now go into the capital markets and borrow against this income stream. So you have an immediate shot in the arm, the money comes in now, but you then service the interest on those borrowings using the levy. Those are some of the innovations that we'll be exploring going forward, because I was asked to comment on financial innovation to support health and the HIV response agenda. So health bond, so watch the space as we go forward next year. We may just do it so that we can give the health sector a shot in the arm. Colleagues, I spoke about 14.3% of the budget being focused on the health sector. There's more. We've been borrowing as government to support infrastructure development. We currently have an arrangement with a company called NMS from the UK, where we are building 30 polyclinics across the country. And then we're also going to build 6 rural district hospitals of the highest quality. If you go into some of these, some of you have been to we are all from around the world, we have visited high quality facilities. These are really high quality facilities, but it's a polyclinic, it's not a large hospital, but it's of the highest quality. So we're making sure there's some infrastructure development that's also supporting the health sector response beyond just a normal budget, and we've borrowed from the private sector to do this. And again, we use some innovative ways to raise the funding. So basically what we did was we borrowed money from South African banks, not Zimbabwean banks, South African banks, but then raised a guarantee for us to enable that transactions to be completed from the Export Credit Guarantee Agency under the South African government. And we thank the South African government for that support, that they allowed Zimbabwe to that. And then the contract is from the UK. So it's quite a complex but clever and innovative arrangement which has allowed us to deliver critical infrastructure in the health sector in Zimbabwe. So I thought I would share this with you. And what I can say is that as government, we are committed to supporting the HIV response program, working with our partners to support them in doing so, but supporting the health sector in general. Let me stop here for now. Thank you.
Fantastic. I don't think the minister is as popular in social media, but once he begins to articulate where the money is going, I think we see that there is a need. And that innovativeness is, or the innovation becomes imperative, because you've got to be creative in this very difficult global economy, and also when Zimbabwe is still facing a battery of issues in terms of being able to raise money for infrastructure and do things. But let's move over to Madame French, who is the acting ambassador. We know certainly of the complementary efforts in terms of the international community when it comes to HIV in particular, and so we'll allow you some time to actually give us your prognosis of what's going on. Thank you.
Great, well, thank you. I don't know if I'm going to be as loud as the Honorable Minister here, but I will try to project my voice until the mics come back on. Good morning, everybody. It's a pleasure to be here with you all today and be with this esteemed group of panelists. I also want to thank UNICEF for putting together this very important panel, because it is a key issue with regards to kind of not just the United States, but all donor assistance to HIV/AIDS assistance. There's three key takeaways I'd like you to kind of take from this presentation. One, the U.S. government through PEPFAR has been committed to Zimbabwe for the last 20 years and remains committed. And in those last 20 years, we've been able to...
In terms of how do we ensure the resources allocated to children really get to the children on the ground? So what is the ministry doing to ensuring effective targeting?
Thank you. Yes, it is very easy to see the difference between children and adults. We have got a department dedicated to deal with issues of children and prevention of mother-to-child transmission. Without mentioning names, but I think the person who is in charge of that is here in this room. Again, drugs which are meant for children are not the same as for the adults. So we've got pediatric preparations which are specifically for children, and that's how we run these programs. So there are programs targeting children specifically, and their budget is drawn differently from the other budgets. Obviously, at the end of the day, we have to do some monitoring and evaluation to make sure that those services are cascaded down from the ministry down to the lower levels, to the ward level and to the clinic level. And there are nurses who are trained also to handle those cases at the clinic level. So that's how we ensure that what is meant for pediatrics is going to the pediatrics, and what's aimed for the adults is going to the adults. I thank you.
Anurita, I'm not too sure if you want to add something to what the Honorable Minister has said. Over to you.
Sure, and can I take it?
Yes.
I'm happy to address
yes.
it. This venue gives new meaning to being on the hot seat. It is warm. I just thought, Honorable Minister, just a small compliment from another angle. And, you know, in UNICEF in many countries, we provide, we do a lot of work in social protection, providing cash transfers to households. And there is, you know, a huge amount of evidence that shows when you give cash to households, they spend it on the right things. They're not spending it on frivolous purchases, alcohol. They're spending it on their children, they're spending it on clothes, on food, on school fees if there are school fees. So, you know, if we're there in the communities supporting and reaching and targeting vulnerable households and families and children, it almost always goes for the right things. I wanted to just thank you, Clarence, for mentioning people living with HIV and people living with the diseases, and also my colleague who mentioned young people and inclusivity. I think it's really a key reminder for us as we talk about building the consensus and the roadmap to be very deliberate about when we say engaging civil society, that we're really engaging the groups who have been in this fight and have really been doing a lot of the work on the ground. So thank you for that, and we take note of that. I also just wanted to say, you know, when we talk about the investments and what's needed, and the Honorable Minister of Finance outlined so many interesting ideas in terms of bonds and sin taxes and the levy we know about, and domestic financing and increased budget for social sectors. We also know there are a lot of competing priorities in the health sector and beyond. Climate, you know, we have a delegation for a COP right now, and we're talking about climate crisis, and we've talked about cholera, and you know, there are a number of competing priorities and competing issues. Added to that are also, in health and HIV, the broader structural issues that we talk about. You know, we're not going to reach our targets and end AIDS without addressing discrimination, marginalization, structural barriers. And so I think when we talk about sustainability and transition and investments, we also have to keep that key foundation in mind. I also want us, when we talk about sustainability, not just to talk about sustaining the finances, but sustaining the technical capacity that is doing the work at, you know, at capital, central, facility, and community level, and sustainability of the leadership, that we don't, you know, just because we start to look at decline in investments, that we don't.
Very much, Director. I think Tajudin, you want to just probably spend about 30 seconds in terms of what you are doing on the ground related to the question.
No, I'll be quick, and I think the Minister said, I just want to highlight 3 things. The first is that last weekend, Zimbabwe launched the triple elimination plan to eliminate mother-to-child transmission, syphilis, and HIV. That's clear. That's a clear investment. Second for me is that in Zimbabwe there is a major focus on adolescents. When you talk about adolescents, they are mostly children. So that focus on adolescent girls and adolescents is another investment. Lastly is the broader work we do under the leadership of the Minister around newborn and child health care, which is the base of where you are able to make contact with women and children, whether it is ANC, delivering care, postnatal care, and all that comes around. So these are 3 deliberate areas of work that we are great to work with the government and partners to support women, but more importantly, the children, the young people, and the
Thank you very much. There are 2 questions that I'm lumping into one. Where I come from, where I always say you don't shave people's head in their absence unless you are not. Now, there are 2 questions which I'm lumping into one, and they say, how do we ensure we integrate the community, and particularly the people living with HIV and AIDS, in the implementation process? And I will direct this one to the Honorable Minister. So, Honorable Minister, over to you. I'm not too sure it's one.
Yes, in our system we have got nurses who have been trained in community work. And we also work with NGOs, civil society organizations. Then we work with people living with HIV and AIDS who have formed their own organizations. These combined, they come up with programs to reach out to the community. But also at the lower level, we've got our village health workers who actually coordinate work at the village level and coordinate work involving our traditional leaders, because we've got a very strong traditional system where we know what we call headmen or pro-heads and Shona Masabu. So at each village, they are there and they are consulted, and they also keep registers on each ailment, and so that they also know those specifically with HIV who are on treatment. So people living with HIV are grouped at the village level, and our village health worker is key in coordinating those activities, and that is cascaded up to national level.
Let me just use this opportunity to say we're supposed to leave. We ought to have left about a few minutes ago, but we just have about 2 minutes, and the remaining 2 minutes will be for mention. Okay, so Doc, over to you.
Thank you so much for your participation. I think what I would not do justice in trying to summarize what the panelists came up with, but I did take copious notes, and between UNICEF and the Zimbabwe Economic Society, as has become our custom, we will compile a summary of today's proceedings, including the Minister of Finance commitment in terms of sticking to the Abuja Declaration, and then also innovative financial solutions. And within his budget, I did take care to note there are 50 clinics, new clinics that he committed to. And that 14.36% is something that we've got to watch. It's one thing to budget. It's another thing, of course, you have actual outturns that are in line with that commitment. Minister, I think your conversancy with the situation on the ground, your commitment particularly to the girl child and to children is central to the work that UNICEF is doing. And so we would, of course, want to ensure that those community projects and the integrated approach that you spoke about, Minister, is actually delivered. I love the fact that we are at twice the level in terms of expenditure that is being allocated to your ministry than we were some 3 odd years ago. And I think that deserves a pam-pam. I am also fascinated, Madame French, to see your continued commitment alongside the partnerships that are possible with the private sector and the community. I think COVID-19 taught us a lot in terms of the involvement of the private sector. And I would see that that's an opportunity, Minister, for us to bring the private sector in to make sure that we've got sustainable patterns going on into the future. I noted that commitment around the health workers. That's a very pertinent one, because Zimbabwe is losing a lot of health workers to the international community. And one wonders, Minister, how we can try and resolve that particular one to ensure that we are able to deliver on the targets that we have. As I said, I'm probably the wrong person to try and summarize this altogether, but it is recorded. We will take and produce our standard reports around this between UNICEF, the Zimbabwe Economic Society, and of course our parent ministry, the Ministry of Health and Child Care, and then of course going back to the Ministry of Finance. So all that remains for me is to hand back to our host, and he can make the closing remarks. Thanks, Dr. Tuji.
Thank you very much, Nigel. Thank you, everyone. I know it's a hot morning. The venue is not the best of itself, but thank you for your steadfast engagement. I want to thank the Honorable Minister for Health and Childcare, Dr. Douglas Mombishora, for spending the morning with us, but for his active engagement and his insight and leadership to the health sector response and coordination in Zimbabwe. Also to thank the Professor, the Minister for Finance, Professor Mthuli Ncube, who left because he needed to catch a flight. But the commitment to be able to still be able to be here, you know, in the midst of all the engagement, including all the bashing in the parliament for more money from every ministry, and the good news about that increase in the allocation to the health sector is gladdening to all of us. Sincere thanks to you, the Chargé d'Affaires of the U.S. Embassy, Ms. French, for being with us and your partnership with the government of Zimbabwe and all parties, including my dear colleague Anurita from UNICEF headquarters. But I can't end by not thanking all the friends here, Dr. Madzima from the 8th Commission, that we plotted this coup and planned this session together. the UNDP resident representative, Hayo Dishola, but more importantly, Nigel, with whom since 2021, we've been running this child budgeting series and try to make that connection for children. Ladies and gentlemen, sincere thanks to all of you. Have the rest of the day wonderful and enjoy the rest of ICASA. Thank you.
Meeting, please. Provide $1.7 billion to supporting Zimbabwe's HIV/AIDS response. And that assistance will continue this year and next year. Two, PEPFAR support has benefited 1.2 million Zimbabweans who are now on life-saving HIV treatment and has helped to control the epidemic writ large in the country over the last 20 years. But I think three, given the purpose of the topic of this panel, we now need to focus on sustaining these gains and ensuring we don't actually backslide from the progress we've made over the last 20 years. Sustainability of the HIV response will only work if we all work together, not just on this panel, but everybody in this room. And it's going to take strong leadership and coordination by the government of Zimbabwe, with active participation from donors, multilateral partners, civil society, and private business as well. Turning maybe more in depth to kind of the sustainability issue. Sustainable HIV response in Zimbabwe requires leadership, accountability, and donor coordination, in particular on the part of the government of Zimbabwe. And we look to the government, especially the ministers on this stage, to lead that collaboration and coordination among the development partners, private sector, and civil society. And I really want to applaud Minister Mamashura in his short time in office. He was appointed only a few months ago, and we've already talked about how much work he's already been doing. He's taken really positive steps to collaborating and coordinating amongst the donors and encouraging a regular dialogue about our response and about that sustainability issue. But I think as already been highlighted by both honorable ministers, the national HIV program here in Zimbabwe is over-dependent on external funding for essential components of the HIV program, including commodities and human resources from health, or HRH, as it's often referred to. We know there are major challenges in retention of healthcare workers and a high migration to other countries outside of Zimbabwe, and that poses a severe risk to the stability of the Zimbabwe's health system. But to address some of these challenges, the U.S. government, through PEPFAR, has been working on a country-led sustainability roadmap. We actually are funding UNICEF to really take the lead, working with the National AIDS Council to kind of come up and build consensus amongst those key stakeholders on how to ensure that we have a sustainable plan going forward. Part of the roadmap's vision is for communities, civil society, and the private sector to be partners with the government of Zimbabwe. And moving forward, it's going to be very important for health financing data to be publicly available and transparency around the use of domestic resources, like the AIDS levy and the airtime tax, which the minister has just raised, in terms of mapping that sustainability and what donor assistance is still needed. Let's see if the mic is on. Give it a second. It is on. Okay, so you can hear me. So, oh, now it's on. Okay, I didn't project again. So after 20 years and $1.7 billion invested into Zimbabwe's health sector, there are still threats to sustainability, and we really do need to kind of think about that going forward and how we're going to tackle that together as in a collaborative effort. Again, chronic shortage of healthcare workers, infrastructure challenges such as power outages, as we're experiencing at the moment, as well as the over-reliance on donor funding for health programming and commodities, as has already been raised. And while we're eager to strengthen collaboration with Zimbabwe donors, need a clear understanding of Zimbabwe's health expenditures moving forward. And I'm very happy to hear all of the work that the Honorable Minister is doing, but I think a lot of that has to be made publicly available too, so that we understand what the government is putting into the health sector. So of particular importance is the government's financial commitment to human resources for health, as we've mentioned, and kind of ensuring that there's an adequately sized health workforce so that they're able to kind of be able to provide the assistance that's needed needed clinics and hospitals throughout the country. Dedication to developing the sustainability roadmap is a good first step, and we look forward to the leadership from the government of Zimbabwe on that process. And we stay committed to that. We stay committed to working with the Ministry of Health, as well as civil society partners and multilateral partners in this country. So I'll stop there, pending any questions when we get to the Q&A. Thank you very much.
I think as Zimbabweans, we love committed donors, and when it's coming from the U.S. Representative here, it is encouraging. I think 20
to hear about the very innovative and diverse ways that you're thinking about this. I think for all of us in UNICEF, we're very excited to feel the energy and hear about it. And I think one of the key important steps around sustainability, because is really having that roadmap. And so thank you for the partnership and the support. It's so important to have a roadmap that really very specifically outlines what we need. It's not that today we have investment from global donors, tomorrow it's going to disappear. We need to understand what that transition is, and we need to see it over time in the short, medium, and long term. And here again, Honorable Minister, I think Zimbabwe will provide the leadership that we need for other countries to really get into the details. What do we need in a roadmap? We need to understand the epidemiology and what the gaps are. We need to understand what the quality of services are and how they might suffer if we lose investments into the sector. We need stable financing. We need a productive and salaried health workforce at both facility and community level. And we need the strategic financing that is varied and broad. You know, I think HIV, again, is kind of that leader that is forcing us to have these discussions and these conversations. What we want to see and where we think we can really provide the leadership is going from financial sustainability to systems improvement. We want to see that improvement for cancer, for NCDs, for the comorbidities. We want to invest in a health system that is responding to all Zimbabweans, all children and adolescents in Zimbabwe. And so I hope that our partnership and our engagement are bringing people together. You know, it's so important. We've heard about the importance around alignment. We've heard dialogue, complementarity, investment. I think for us at UNICEF, we also want to help build the trust and the consensus, so we have a common understanding of what's involved and what we need to do, and then have our milestones along the roadmap. My plea today is let's not make children an afterthought when we have these big discussions around investment and sustainability. For me, I talk about children living with HIV/AIDS. My colleague Tajuddin here, we're talking about the welfare and the health of all children in Zimbabwe. The situation for children is often an incredible indicator about the health and well-being of our systems and people overall. So I hope we can continue that investment with that broader lens.
Thank you. Okay, we're back on so clearly power, Minister. And on that note, I think I'll hand over for a quick Q&A directed primarily at the Minister to begin with. Our UNDP representative, Dr. Adesole, will take us through the question and answer session. Over to you, sir.
Yeah, thank you very much. Before the Honorable Minister of Finance leaves, he has an appointment that is very urgent. Can I just say from the audience, do we have any pertinent questions that we want to ask the Honorable Ministers? How many hands? Oh, it has only 2 minutes. So please, just go straight to the question. Yeah, can I start based on proximity? Here, one in the back, and one in the middle. Yes, he has a flight to catch. So, just probably one. Yes, yes.
Ok, merci pour l'opportunité que vous me donnez. Honorable ministre des Finances. Chef service de lutte contre le VIH au ministère de la Santé publique. My name is Dr. Ketia Dialif. I'm the chief of fighting against HIV in the Ministry of Public Health. So, one question. In Abuja, research we shows 50% of our county budget for the health system. Just want to know whether this recommendation is effective in Zimbabwe. And the second question, I just want to know if there is...
Excuse me? Only one,
health
please.
System coverage in Zimbabwe.
We will ask the question to others. You want to respond to this first? Okay, let me give you the mic.
Well, let me apologize, moderator and colleagues. I have to catch a flight, so I actually have to leave in exactly 60 seconds. It's a very good question. Does the Abuja target matter or not? It does. It does. When we budget, we take it into account. I did say that when I was presenting that before 2020, we're struggling to meet the Abuja target. We're averaging 7% of our budget being targeted at the health sector. We've since improved. For the 2024 budget, we're at 14.3%. So we're there. We're there. And we watch it every year. We take that seriously. And we continue to innovate, as I explained, with different funds, whether we're supporting the HIV response with the 3% levy, or whether it's a health bond issue that I talked about. As I said, watch this space. Next year, Zimbabwe, we're going to launch a health bond because we know there's no limit to innovation. Whether we're looking at the health, the infrastructure as well, we'll continue to innovate. But that 15% target, we always have our eyes on it. I thank you.
Yes.
Carry on.
Okay.
Carry on.
Yes. Yeah, thank you very much, Honorable Minister of Finance. Yeah, colleagues, your questions that have not been answered, once we have them, we will direct it to him and he will respond. Yes. Well, we have all our panelists here except him. And I know based on the scintillating discussions we've been having, we may be having some kind of questions. Please, we want to try as much as possible to get many people, but do not exceed 1 minute. Please, go straight to the question. If it is an amplification, just go straight to it. No preamble. Yes. Oh. Oh, okay. All right, let me start from your side.
My apologies, I just stood up. My name is John Kasim, the Minister of Health. I'm a journalist from SABC Channel Africa. People living with HIV in Zimbabwe, they say, when they go to an OI clinic, they expect a lot, including tests for TB, diabetes, hypertension, and quite a number of infections related with HIV. But all they get there are ARVs. Even the screening of, or even the counseling sometimes done here and there, which gives them a big problem when they go home, because some of the morbidities, they don't know about them. At what stage is Zimbabwe going to start issuing services like that at OI clinics, so that people don't lose even money, the little money they have, to go to private hospitals to get screened for diabetes and other challenges?
Thank you very much. I think that will be to the Honorable Minister, but
let's take it.
Yeah, we'll take. Yeah, let me go to, yeah, I saw a hand in the back. Don't worry, I will come to you. There was a hand in the back. All right, the hand disappears. Okay, you. Please just mention your name, your designation, and question.
Thank you so much. My name is Clarence Mademsa from the Zimbabwe National Network of People Living with HIV. So I'd like to thank the Honorable Minister of Health. I think he spoke to issues of communities. And being the community of people living with HIV, we are very happy and keen to be part of this, the roadmap. I know we've had engagements around the roadmap for sustainability. And the Minister spoke about communities being vital cogs in terms of the next mile, in terms of sustainability. And it would be remiss of me not to just mention that 0 to 14 we are definitely worried about as a community. 69% is not where we should be. Children are missing, falling through the cracks. And as a community of people with HIV, what we see is that the community can play a very big role in finding those children and linking them to care. Just one last point.
What is the question?
Innovation. I just wanted to highlight innovation. So in terms of innovation, I'd like to just speak around National AIDS Council and social contracting. And we're happy that National AIDS Council is rolling out social contracting, and we hope that this will be supported significantly from the Ministry of Health, because social contracting makes sure that services reach down to the community. And as NP Plus, we are one of the partners around social contracting. So it's really just to extend the thank you to National AIDS Council and also to the Ministry of Health. And we say, let's push this innovation in terms of sustainability.
Thank you very much. Okay, lady. All right.
Hello.
Let's go to lady in white. Yes. There.
Hello. I already have the mic.
No, can you give it to her? No, don't worry. Give it to her, we'll talk to you next. I didn't see you. The first bench blocked you. Sorry.
Okay, thank you very much. My question goes probably to the Minister and the rest of the panel. Yes, we're talking about child budgeting and ensuring that we've got enough response in terms of what is going to the children. But my question is, how are we ensuring that where we have invested, for example, $5, that $5 actually reaches the deserving child, and that particular investment that we've made has made impact in terms of what we want to achieve. So my question is, how are we ensuring that what we have invested actually reaches the child and is not spent on something else? Thank you.
Thank you very much. Over to you, please.
Okay, thank you very much. My name is Denzel Water. My question is on the children and young people in the remote places. I already know that there's a lot which is already being done to try to bring inclusivity to them. But my question is, how much more is there? What structures are there to increase the inclusivity of their participation, their ideas, and also the addressing of their problems?
Thank you very much. The last question. Yes, over there.
Thank you very much, Wetundebele from Blawa. This question was directed to the Minister. of finance, I will still ask you. My question is that if you tax the parents to the children to poverty, the workers that are supposed to work in the state-of-the-art polyclinics that you are building, you are shooting yourself in the foot. There will still be no people to look after those children. So let's be aware that we are not killing the cow that gives us the milk. Then the other one is how to incentivize those workers. Thank you.
Yeah, thank you very much. Well, the Honorable Minister and the panelists will answer these questions now. If we have time, then we'll come back to you. Honorable Minister, you want me to guide you on the questions?
Yes.
Okay. Yes, the first question is about co-mobility screening services.
Yes.
How do we ensure that people have access to it? The second one is
Wait,
okay.
Let's go on.
All right, this one.
I think there were too many questions.
Yes.
I thought I was going to answer as they were being posed. First and foremost, when we talk of our OI clinics, there are different levels. The lower level clinics, which you find like in the rural areas and so forth, mainly deal with dispensing for those who are already on treatment. But we have a higher level clinic where diagnosis can be made. So it's not every clinic that can make a diagnosis. So the levels where you make diagnosis, which are mainly like at the district hospitals where you have a doctor, because we don't have doctors at our clinics out there. That's where you can have your x-rays, screening for TB, you can have your rapid diagnostic tests, and laboratory facilities and counseling. But when we go to the lower levels, usually it's just dispensing. So the facilities are there, but we would want to have more. We are also in the process, like you heard from the Minister of Finance, that we are going to build clinics and district hospitals. We've targeted 8 district hospitals in the coming financial year, and we have already started constructing lower level. This is a new type of hospital where we are building 20-bedded hospitals, and already we have had one in Harare, one in Bulawayo, one in Mashingo, I can't remember the fourth one, and we have got another 4 to construct. At these levels, we are also trying to introduce doctors and equipment to be able to do diagnostics. So we are improving, we are working on improving that access to proper services that will provide comprehensive services, including counseling, testing, and treatment. So I think that's where we are. Obviously, at times we need to increase our communication skills so that the patients know that when they are going at this level of clinic, they cannot access these types of services. These types of services are accessed at a higher level. So it's proper communication which we need to improve on so that all our citizens are able to know what they access at what level. The second question.
On this issue? Okay.
So maybe to give the Minister of Health a slight breather and so he can catch up on the next question, I'll just quickly add, I've been able to go out and visit a number of PEPFAR funded related clinics around the country. I was able to visit one just last week in Victoria Falls, and I was pleasantly surprised that they were doing comorbidity screening when they came into the PEPFAR clinic. Some of their issues could be addressed at the clinic, some had to be referred to the local hospital, but they were able to kind of do a number of screenings as individuals came in. Another thing PEPFAR has been able to support this year, and I know it's still somewhat small scale, but it's really hearing from all of you and some of the concerns around this, is we have been able to add things like cervical cancer screening over this last year. Over this year, I think we provided nearly 240,000 cervical cancer screenings at PEPFAR-related clinics. We were also able to do TB testing and treatment for over 200,000 people that came into PEPFAR-related clinics. I know it's not everywhere, and I know it's not at every PEPFAR clinic, but we are hearing that issue from civil society and trying to respond and ensure that those sorts of issues are being addressed at these PEPFAR-funded clinics as well. So I'll just stop there.
Yeah, thank you very much. The next question will be to the Honorable Minister in terms of how do we ensure the resources allocated to children really get to the children on the ground? So what is the ministry doing to ensure effective targeting?
Thank you. Yes, it is very easy to see the difference between children and adults. We have got a department dedicated to deal with issues of children and prevention of mother-to-child transmission. Without mentioning names, but I think the person who is in charge of that is here in this room. Again, drugs which are meant for children are not the same as for the adults. So we've got pediatric preparations which are specifically for children. And that's how we run these programs. So there are programs targeting children specifically, and their budget is drawn differently from the other budgets. Obviously, at the end of the day, we have to do some monitoring and evaluation to make sure that those services are cascaded down from the ministry down to the lower levels, to the ward level and to the clinic level. And there are nurses who are trained also to handle those cases at the clinic level. So that's how we ensure that what is meant for pediatrics is going to the pediatrics, and what's aimed for the adults is going to the adults. I thank you.
Anurita, I'm not too sure if you want to add something to what the Honorable Minister has said. Over to you.
Sure, and can I take it?
Yes.
I'm happy to address
yes.
it. This venue gives new meaning to being on the hot seat. It is warm. I just thought, Honorable Minister, just a small compliment from another angle. And, you know, in UNICEF in many countries, we provide, we do a lot of work in social protection, providing cash transfers to households. And there is, you know, a huge amount of evidence that shows when you give cash to households, they spend it on the right things. They're not spending it on frivolous purchases, alcohol. They're spending it on their children. They're spending it on clothes, on food, on school fees, if there are school fees. So, you know, if we're there in the communities supporting and reaching and targeting vulnerable households and families and children, it almost always goes for the right things. I wanted to just thank you, Clarence, for mentioning people living with HIV and people living with the diseases, and also my colleague who mentioned young people and inclusivity. I think it's really a key reminder for us as we talk about building the consensus and the roadmap to be very deliberate about when we say engaging civil society, that we're really engaging the groups who have been in this fight and have really been doing a lot of the work on the ground. So thank you for that, and we take note of that. I also just wanted to say, you know, when we talk about the investments and what's needed, and the Honorable Minister of Finance outlined so many interesting ideas in terms of bonds and sin taxes and the levy we know about, and domestic financing and increased budget for social sectors. We also know there are a lot of competing priorities in the health sector and beyond. Climate, you know, we have a delegation for COP right now, and we're talking about climate crisis, and we've talked about cholera, and, you know, there are a number of competing priorities and competing issues. Added to that are also, in health and HIV, the broader structural issues that we talk about. You know, we're not going to reach our targets and end AIDS without addressing discrimination, marginalization, structural barriers. And so I think when we talk about sustainability and transition and investments, we also have to keep that key foundation in mind. I also want us, when we talk about sustainability, not just to talk about sustaining the finances, but sustaining the technical capacity that is doing the work at, you know, at capital, central, facility, and community level, and sustainability of the leadership, that we don't, you know, just because we start to look at decline in investments, that we don't.
That's clear. That's a clear investment. Second for me is that in Zimbabwe there is a major focus on adolescents. When we talk about adolescents, they are mostly children. So that focus on adolescent girls and adolescents is another investment. Lastly, is the broader work we do under the leadership of the minister around newborn and child health care, which is the base of where you are able to make contact with women and children, whether it is ANC, delivering care, postnatal care, and all that comes around. So these are three great areas of work. There are great support with the partners to support women, but more importantly, the children, the young people, and thank you.
Thank you very much. There are two questions that I'm lumping into one. Where I come from, where I always say you don't shave people's head in their absence unless you are doing it. Now, there are two questions which I'm lumping into one, and they say, how do we ensure we integrate the community, and particularly the people living with HIV and AIDS in the implementation process? And I will direct this one to the Honorable Minister. The Honorable Minister, over to you. I'm not too sure if you
Yes, in our system we have got nurses who have been trained in community work. And we also work with NGOs, civil society organizations. Then we work with people living with HIV and AIDS who have formed their own organizations. These combined, they come up with programs to reach out to people. But also at the lower level, we've got our village health workers who actually coordinate work at the village level and coordinate work involving our traditional leaders. Because we've got a very strong traditional system where we know what we call headmen or co-heads and Shona Masabi. So at each village, they are there and they are consulted, and they also break each ailment, and so that they also know those specifically with HIV who are on treatment. So people living with HIV are looked at the village level, and our village health worker is key in coordinating those activities. That is cascaded up nationally.
let me just use this opportunity to say we're supposed to leave. We ought to have left about 2 minutes ago. But we just have about 2 minutes, and the remaining 2 minutes will be okay. So, Doc, over to you.
Thank you so much for your participation. I think what I would not do justice in trying to summarize what the panelists came up with, but I did take copious notes, and between UNICEF and the Zimbabwe Economic Society, as has become our custom, we will compile a summary of today's proceedings, including the Minister of Finance commitment in terms of sticking to the Abuja Declaration, and then also innovative financial solutions. And within his budget, I did take care to note there are 50 clinics, new clinics that he committed to. And that 14.36% is something that we've got to watch. It's one thing to budget. It's another thing, of course, you have actual outturns that are in line with that commitment. Minister, I think your conversancy with the situation on the ground, your commitment particularly to the girl child and to children is central to the work that UNICEF is doing. And so we would, of course, want to ensure that those community projects and the integrated approach that you spoke about, Minister, is actually delivered. I love the fact that we are at twice the level in terms of expenditure that is being allocated to your ministry than we were some 3 odd years ago. And I think that deserves a pam-pam. I am also fascinated, Madame French, to see your continued commitment alongside the partnerships that are possible with the private sector and the community. I think COVID-19 taught us a lot in terms of the involvement of the private sector. And I would see that that's an opportunity, Minister, for us to bring the private sector in to make sure that we've got sustainable patterns going on into the future. I noted that commitment around the health workers. That's a very pertinent one because Zimbabwe is losing a lot of health workers to the international community. And one wonders, Minister, how we can try and resolve that particular one to ensure that we are able to deliver on the targets that we have. As I said, I'm probably the wrong person to try and summarize this altogether, but it is recorded. We will take and produce our standard reports around this between UNICEF, the Zimbabwe Economic Society, and of course our parent ministry, the Ministry of Health and Child Care, and then of course going back to the Ministry of Finance. So all that remains for me is to hand back to our host, and he can make the closing remarks. Thanks, Dr. Tuji.
Thank you very much, Nigel. Thank you, everyone. I know it's a hot morning. The venue is not the best of itself, but thank you for your steadfast engagement. I want to thank the Honorable Minister for Health and Childcare, Dr. Douglas Mombishora, for spending the morning with us, but for his active engagement and his insight and leadership to the health sector response and coordination in Zimbabwe. Also to thank the professor, the Minister for Finance, Professor Mthuli Ncube, who left because he needed to catch a flight. But the commitment to be able to still be able to be here, you know, in the midst of all the engagement, including all the bashing in the parliament for more money from every ministry. And the good news about that increase in the allocation to the health sector is gladdening to all of us. Sincere thanks to you, the Chargé d'Affaires of the U.S. Embassy, Ms. French, for being with us and your partnership with the government of Zimbabwe and all parties, including my dear colleague Anurita from UNICEF headquarters. But I can't end by not thanking all the friends here, Dr. Madzima from the 8th Commission, that we plotted this coup and planned this session together, the UNDP resident representative, Hayo Dishola, but more importantly, Nigel, with whom since 2021, we've been running this child budgeting series and try to make that connection for children. Ladies and gentlemen, sincere thanks to all of you. Have the rest of the day wonderful and enjoy the rest of ICASA. Thank you.